in this video about outpatient visit recording, and this can be outpatient in the in a hospital or healthcare institution or in the community. Um, and most of the time, these outpatient visits can be linked with a booking. But I'm not going to talk about booking in this video, but there will be a video related to this, and which would cover more around outpatient recording with the booking. So let's go to one of the patients, and I'll show you an example, and I'll show you how it's entered. So I'll go to this patient here. All right, so I'll select this patient. Now, in this patient, there's a booking. There's already entered a record here under Clarence City Hospital. Now, this is actually endocrinology. So I'm going to that visit. Just clicking go. So if I go there, I can see the main information here. What's the type of the visit? What's the name of this clinic visit? And what's the template used to capture information? And then what's the endocrine, what's the department of this particular visit, so where this visit is belong to. And all these our visits has sort of a department as their parent, in an organization. And then there might be different clinics in one department. Let's say now here in endocrinology, there might be endocrinology main outpatient clinic, and there might be a diabetic clinic. There might be diabetic foot care clinic. There might be a diabetic nurse education clinic, etc. So then you can have multiple clinics. So therefore, the clinic name is really important here. And the other important thing, what's the template? Template is like what sort of data capturing mechanism that you have. These templates, of course, here I am using sort of a general template for outpatient care visits, but you can define your own templates, because using templates can make it really easy. And also it will help the data capturing with validation, and monitoring and evaluation is supported with that, and also quality and safety of patient care is improved. And here you can see further what's the location of the clinic, what's booking information if it's a book clinic, and what's the reason for the visit, what's the complaint or the main complaint. And then if I give sort of a remark now here, as a tooltip, the remarks come the left foot ulcer. That's the diabetic foot ulcer, is foot wound is the main complaint, and the diagnosis diabetic foot ulcer. And then and there might be secondary or else other reasons or complaints or diagnosis in that particular visit. There was acute kidney injury and cellulitis in this patient. So acute kidney injury, it shows more remarks which I have entered. I'll show you how this is done. So if I click one of these, it shows more, how to update. I'm going to update this one. I'll show you a new one. And then the signature, time signature, which comes as automatic kind of a signature for this particular visit. And then and start date and end date. End date is captured according to the time that you are finalizing the event. And then I'll discuss more on this later. And then this is the main note, which is like a dummy note. So you can put whatever the notes, and you can go to you can put templates there as well, like this. You can grab templates and put it there. Let's say if you want to have a cough, this kind of a template comes. Or the template, you can define your templates, and you can store, and you can make it available for yourself, or you can make it public. And then once I expand this, it gives the vitals that you are recording while this the visit is happening. So this vital actually goes to patient profile, because patient, it's like it according to timeline this is captured. So you can have a look there. Now let's say now this was captured in this particular day, that was 10th. So if I go into outpatient sorry, if I go into observation, entry or summary, here, I'll show you more. Observation summary here, this one. Then the pop-up comes with the observation, all the observation patient has so far. Now, since we have only one recording, it's recorded like this. But once you have more recordings, then that would be graphically that will be shown here. Yeah, so let's get out of this one. So I'll go more in detail. So activity log, that's of course what you really did during this episode or close to this episode. So this is actually, for the time being, it will be sort of a manual kind of entry, but in coming versions this would be upgraded into automatic kind of data capturing here, using the activities, going through the activities you are doing close to this particular episode if it is not finalized. Then further, if I go down, you can see what sort of templated kind of or discrete kind of additional information we have here. So now we have this is something like ISBA kind of format maybe, or else whatever the format that you want. Or else if you have a special kind of patients coming, then you need to capture special information, which should be important for monitoring and evaluation, to improve the quality of data information that you are capturing while the episode happens. That can be easily done, right? And then the other one, of course, attachments. Now here we have one attachment here, foot also, that's the photo or any videos or any links you can include here. And secondary notes, of course, something like a nurse, let's say a nurse is providing sort of care to this patient, and they want to add more information. So that can be done through this without changing anything in the main note. And then billing is provided, supported as well. Billing item numbers. You can include your own billing item numbers, or else available whatever the numbers is available in Medicare, or whatever the funding, private or public funding you have here. So that would be more expanded, or else more educated as we go ahead. And then I'll show you what are the how we are entering on the records. Let's say now we're going to enter an unscheduled kind of episode for this patient. I'm getting this one. I'll collapse this one, hide, so that we have more space here. So I'm going into outpatient. So I'm going to initiate new, and I'm putting unscheduled here, because this is not scheduled. And then hospital clinic, let's say this patient is outpatient, but this patient is coming for, let's say, cardiology, right? So I'm going into cardiology department. We have to select the department here first from this. What we need is here the visit name. Visit name comes from according to the department. That's why I'm selecting the department first. Once you select the department here, then all the clinics in that department, which has already defined in configuration, that would come here. So let's say this patient has heart failure, patient is coming for heart failure clinic, and the visit happens, let's say 9 o'clock. And then you are doing, saying patient attended, and then episode related information. What's the reason for the visit? Let's say SOB on exertion, right? Something like that. SOB on insertion. And you can select the terminology list according to this, so which I have already discussed in other modules. But I'm just putting this one here since this is sort of a demonstration. And then I'm going into the name of the location, right? So let's say this has happened some in the cardiology clinic, right? So then I'm selecting that one. That will be selected here. So here you can change what's the location type, like outpatient clinic, or this might be board, whatever. And then who's the responsible consultant? So I'm putting a name here. This is the responsible consultant. and then who's the care provider. So this will list all the care providers in your clinic. Let's say here. So that's administration. So we'll go to somebody like yeah, that's fine, nurse. And I'm putting I'm done. It's done. So what I have to do, just click this create button. Now here it shows for the what is already initiated. That's something you can have a look. So create, right? So it's created. Now it has come with the information I have already given there. So there you can put additional information here. Let's say if you have a diagnosis here, you can put the diagnosis. Might be heart failure, congestive cardiac failure, CCF. Let's say, let's see whether we can get the diagnosis here. Here we go, congestive cardiac failure. That comes from the SNOMED terminology list. Increased SOB on exertion. I put as last echo injection fraction 35%, something like that. So this is some technical information. Left hand, left hand, right. Right. So that's something, just for the. Now it will come like this, and SOB. If I need to put a increase for last 1 month. That's a distribution. All this will come into your report in the end, right? And if the patient has sort of secondary kind of complaints or diagnosis, you can add those as well. Let's say patient has weight loss. Weight loss. When we have a complaint like that. Weight loss, yeah. Lost 10 kilos in 3 months, right? That's something that different problem, but still that complaint comes. And yeah, so likewise you can add whatever the number of complaints you want, and then now this is done, and then you are going into adding more information. Let's say if you want to have a template here, let's say CCF template, like you want to add this bit, shortness of breath. So that's done. Copy, and then short of with worsening, although yeah, yes, this is sort of a template. You can define your own template whatever you want. None. Pedal, edema, legs, and weight gain, weight loss. Lethargic. Heart, the rhythm. Now, all these actually to reduce the time that you are, for the you are doing the entering. You can put templates. I'm just doing this one since this is a demonstration. So I'm going to put some values for these vitals. So let's say 155, 85, heart pulse rate 98, temperature 36, and consciousness alert. We don't need this. Let's say finance, right? And then activity log, you can put whatever education provided, right? Okay, and that's it. So this save this one. So now the usual information, the main information already done now. So but you can have a bit here, and you can fill the whatever the records that you want. Here, let's say we can find anything here. You can grab information from background. And looks like there's no any problems here. So, but I'm going to add something like, let's say, background diabetes, type 2 diabetes mellitus, right? If you have any records in that background or else profile, you can copy and paste, just drag it from there to here. And examination, there's a different place for that. You can put the examination findings there. And then let's say problem list. I'm gonna put fluid resolution. Follow. Let's say repeat echo. This is sort of an example, right? All right, so yeah, it's done. So let's say now this is done. You can add any attachment here if you want. Easily you can click this one, and now this is that which was added before this. So I can add new one, and new, and let's say you want to add a file. Let's say this is the file that you are adding. It's too big, so I'll select a different one. It's too big. I'll select a different one. Give me 1 second. So I'll select, let's say, I'm selecting this one, like PDF or PNG file, or whatever you can select. Test entry. Yep, like that. Makes it. So then now you can see it's here. You can show like this. So the other one I wanted to show here now, that's done. The other one I wanted to show here, how the vitals are recorded. Now the vitals here done. So if I go here to vital summary, sorry, observation summary, if I click this, now you can see it's already there. It's already there now. It's getting recorded with a like line chart. So yeah, so that's going into patient profile. And the other one, secondary note. So secondary note, it's done by, let's say, not you, it's by, might be somebody else, like a nurse or somebody who wants to add a note. So they can't change anything in this main note, but they can view the note. What they can do, they can attach their note here. Like, let's say if they want to add something, test secondary note 1, like that. It will be simply added like this. So then now it will come with their credential, their names, and then that would be there, right? And then billing can be done as well. So that's it. So now your outpatient note is created. So what I'm going to do, finalize now. Finalize. So now this is the note. You can see the basic information. Now, once this is done, of course, in time will come as well. And the reason, main diagnosis, comes with the information that I've already given. And further, second, now if you want to change any format here, you can easily do it here like this. That's doable as well. And let's say you want to get this one up here like that. Then like that, its main information is captured, and then additional information like templated information that's captured as well. So let's say BNF 550, something like that. So HP normal, HP normal, something like that. So yeah, yeah. So that's it. So it will give the activity log and the version number and finalize. Finalized. So now you can see it's gone. If you click show note, it will show you the notes that you have already done, and it like the versions. Now um, here now we have just one version, but if you have amended and put another version, that would come as version 2. So I'm going to show this one to you now. Here, this is what we have done already. The note is there. Let's say if you want to print, simply you can just click this button, and that would be previewed, and you can take a printout for your, if you need to have a paper-based record as well. And if you want to email, and you can give the email address of that particular person. This depends on the configurability of your organization, if they allow to send an email to somebody outside the organization. So it's quite doable. And then just, like this is, now you can get format this a little bit, like you can get, if you think you don't need this bit, you can take that one out. That's totally fine. And then this is how the note comes. So so that's it about outpatient record. And then I'll show you how this is done from the booking as well in another video. Thank you.